if it is important to have a device that works invasive and non-invasive. So it's more important for doctors or for nurses. Okay, well, when you are working at the bedside, you realize, really clearly, that a ventilator is important to be invasive and non-invasive because you don't have to change the ventilator from one treatment to the other. So it's really important, and also because you know exactly what the ventilator is and what a ventilator performs. So if you don't change the ventilator, it's really easy to change from one ventilation to another because you don't have to change the machine, and also you know exactly what is the performance of that ventilator. So it's really interesting from my point of view. It's really easy, and you save time and you save effort and you save a lot of things if you have a ventilator that can be used in both situations, as was seen in the paper from Bob Kaczmarek. Can go back to this, that is the ability to effectively ventilate all patients in all settings, invasive and non-invasively, will be one of the features of the future. And this is very important. Is is more important for. It's important for doctors, but also for nurses, because nurse is the first line of the treatment, for the patient, and the nurses stay, at the bedside during all the day, all the, the duty cycle, and they work there very hardly, and they have to change the ventilator and to change the mode and to think in different terms when they change the ventilator is really tough. So it's very good for us. I think it's a very important issue for the nurses and respiratory therapists.